South Africa officially has exited the third wave of coronavirus infections. According to the NICD, the national 7-day moving average of new daily recorded cases, the test positivity rate and the testing rate were all falling, with sustained decreases reported in all provinces. The coronavirus pandemic has hit SA harder than any other African country, with more than 2.9 million recorded cases and more than 87,000 registered deaths from COVID-19 complications. According to the NICD, South Africa's 7-day moving average of a new daily recorded cases stood at 2,045 on Sunday, and that's almost a tenth of the peak in early July, whilst the test positivity rate stood at 5%, and that's down from more than 30% at the peak of the third wave. Similarly, the daily number of tests had fallen from a peak of more than 75,000 to 19,160. For more on this, we're now joined via Skype by Dr. Michelle Groome, who's the Head of Division in the Public Health Surveillance and Response at the National Institute for Communicable Diseases. Thank you so much indeed for joining us, and welcome to the program.
Good evening to you and all the listeners.
So we are out of the third wave. Is that for sure? We can rely on that?
Yeah, so according to the metric, and so that was decided by the Ministerial Advisory Committee in terms of how the wave was defined. And so when we reach 15% of the previous wave's peak in terms of the case incidence, we're kind of officially then out of the wave. And so nationally we reached this over the weekend, and 6 of the 9 provinces have exited the wave, with just the Free State, Northern Cape and Eastern Cape not yet having crossed that threshold.
So the numbers of people being tested has dropped as well. So do we now rely on test positivity rate just to confirm that this decrease in numbers of tests actually reflects a decrease in the rate of infection?
Yeah, so I think, as you know, I mean, all the tests, the case numbers depend on the number of tests that are conducted. And what we've seen, even with the previous surges, is that obviously as the infection numbers decline, so does the testing rate. And so obviously the number of tests have declined, and therefore the number of cases have gone down. But together with that, I think a very good metric is the percent testing positive. And as you mentioned, this has decreased to 5%, and that's where we'd like it to be under 5%, and that is what we've seen in the previous surges, where we've been between the surges.
All right. So what does that mean for us? Should we remain vigilant because we've seen these waves come back, or is there going to be a different path now, given that we're doing quite well in terms of the vaccine rollout now?
Yeah, so I think we do have a chance now to really get our vaccine program, going, vaccinate as many people as we can. I think we've got just over 20% of the adult population fully vaccinated, and just over 30% who've received at least one of the doses. So either one dose of Johnson & Johnson or the first dose of Pfizer. So we really, we want to vaccinate far more than that. But definitely, all those that are vaccinated, even that proportion, with as we increase, we will see the impact in terms of specifically the severe disease. So we're really wanting to decrease the number of hospitalizations and deaths. So it's definitely not time to return to normal yet. And while we're still trying to get our vaccination rates up, I think we're still going to need to adhere to the mask wearing and social distancing and hand hygiene. So definitely not time for complacency, but definitely the time to really expedite our vaccine program.
Do we know for certain that the vaccine rollout has had an impact already?
Yeah, Yeah, I think it's difficult to see with this wave if it's really, I think, this wave probably followed the same type of trajectory as with the previous waves. So I think we hadn't vaccinated a lot of the population at the start of this wave. So I think we're likely to see the impact of the vaccination with the coming infections. And we are likely to see resurgences, but hopefully, not as high as we saw with the previous waves. Obviously, the one unknown is just in terms of any new variants that might, surface. But at this stage, we really are keeping track of that via our sequencing. And at this stage, nothing yet that we're concerned about in terms of a new variant, with Delta still accounting for over 96% of the infections at the moment.
Talking about new variants, if we think about how Europe, North America, and other regions have had a high level of vaccinations already, does that mean that if there is a new variant, it's likely going to be generated from this continent?
It's very difficult to say. I think the beta variant did originate in South Africa, and we had detected another new variant, which was the C.1.2. But we are monitoring, and thus far, the C.1.2 has not increased in proportion over the months as Delta did. And we're still, busy doing some of the tests in terms of transmissibility and to see whether it would evade the immune system. But at this stage, it looks like it should be similar, at least, or somewhere between beta and delta. And so we would expect that, any new variant that would arise, that the vaccines would still be able to protect against severe disease, so which is the hospitalizations and deaths. And that's really what we would like to do is, the effectiveness is slightly lower against infection, but at least we can prevent the severe disease. And that's what's been seen, for example, in the UK, which did see increase in the number of infections due to Delta, but didn't see that reciprocal increase in hospitalizations and deaths.
All right, so, I'm always getting a bit nervous now because we've seen this time and time again, but has the picture changed in terms of a likely fourth wave scenario, given that we've moved quite quickly with vaccination since perhaps when we first started pointing towards a fourth wave, October, November, I think was what was said?
Yeah, so I think we definitely will be able to change that. I think even with, the proportion that's been vaccinated at the moment, I think we should see an impact in terms of definitely the rates of hospitalizations and deaths. And so we wouldn't really expect, a fourth wave to be as large as what we've seen. There's also, a large proportion of the population that has actually been exposed to COVID and had the disease either with symptoms or asymptomatically. And so that will also give a level of protection. And we know that, our case numbers are far underestimating the actual number of infections that we have in South Africa. And so, we are awaiting some updated results of our seroprevalence studies. So that means just looking at the proportion of individuals that actually have underlying antibodies. And so either through vaccination or through previous infection in one of the waves, I think a large proportion of our population does have some level of protection, which is different to when COVID started, when it was coming into a totally susceptible population.
There's a lot of increased activity that's taking place now. I mean, I was on a plane last week. I flew to Durban, and I have to tell you, if I hadn't have been double jabbed, I would have been scared out of my wits because everyone was packed like sardines in these planes. I had hoped that there would be space in between each seat, and I just wonder if we have to get up economic activity, but the rate at which we're doing it, is there a fear maybe that, we might be opening the door for more infection?
Yeah, I think it's a very difficult balance. I think economically, the COVID pandemic has really, hit us hard. And so I think we really do need to look at ways to open that up. I agree with the flights. I think I've also been on a flight which was relatively full. So I think we need to just, as I said, we can't neglect, the social distancing, the mask wearing, the hand hygiene as much as possible. And I think social gatherings and such like will still remain the big risks. And I think particularly, in the months now, leading up to the election and potentially social gatherings that might happen as a result of that. And so that's why I think we really can't let our guard down. I think often as the case numbers go down, people kind of, forget about adhering to everything and to the other measures. And I think we really do need to still be cognizant of that. But I think we can really, start opening up, more than we did in the past, knowing that more and more people are being vaccinated.
But lessons, I suppose, we can learn from other countries in the world. I mean, the United Kingdom was almost set to declare the country free, and people started picking up infections again. So it can turn quickly if we're not vigilant.
Yeah, I think what we really need to realize is that, at the beginning of the pandemic, we, were hopeful that we would be able to, eradicate the virus, which really does not seem to be an option. And actually, we haven't ever eradicated any other respiratory viruses. So I think, we need to know that there will still be infections, but most of these are going to be mild. In the vaccinated individuals. And so we would expect to see increases in infections at some time, but we don't want to be seeing that increase in hospitalizations and deaths, which is going to, which has put such a big burden on our health systems. So if we can prevent the severe disease, then I think we can really start moving towards kind of accepting, we're going to have COVID with us for the foreseeable future. And so we need to be looking at how we get back to, more to normality, where we can prevent severe disease and yet may still have to contend with mild cases of COVID.
And summer is on its way, and I suppose that also points positively in our favour.
Yes, no, definitely. So I think people are more likely to open the windows and gather outside, which was something with the winter. So, yeah.
All right, Dr. Michelle.
Definitely some positives to look forward to.
Dr. Michelle Groome, thank you so much indeed for joining us, and your insights greatly appreciated. Thank you.
Thanks.
All right, so that's Dr. Michelle Groome, Head of Division, Public Health Science Surveillance and Response at the National Institute for Communicable Diseases. So we're out of the third wave, but please, don't take that to mean that COVID's done. Do all the protocols, get your vaccinations done. Let's carry on being vigilant.